Cryotherapy, it's certainly an area that gets a great deal of attention, a lot of publicity just by its very name and things associating with freezing and the study of freezing. We're going to talk a little bit about that and other issues with Renee Ebersole, and we're going to talk about the science of, I guess it's called new science of body freezing. You know, when I think of body freezing, I think of Walt Disney. I think of Ted Williams and stories like that, not necessarily cryotherapy, treatment, those sorts of things, and medical benefits. The whole concept of suspended animation is really where my mind goes, and I'm wondering if a lot of my physician audience thinks the same way because they don't know a lot about it. So tell me a little bit of the history of cryotherapy, what you know of it, and how the benefits that could maybe make a difference in the medical world.
Yeah, so I agree with you. A lot of people do immediately go to cryogenics, and the interesting thing about cryogenics is, you know, there are a lot of people just sort of on ice at the moment, and they don't really know how to repair the damage from freezing for those people, those many people who are at the facilities where they're doing cryogenics. The thing about cryotherapy that's very different is it's not putting your body on ice. It's not, you know, some of those people, they get their heads severed. You know, it's a much more invasive procedure after you're dead. This is more like just cooling down your body. Athletes have been using icing for cooling their bodies and reducing inflammation for a very long time. And now there's this great new trend to use cryo spas, cryotherapy units. They have them at some gyms. There's cryotherapy salons popping up in many cities. And the idea is basically they chill your body down to a pretty low temperature and try to keep the skin temperature at about 40 degrees. And you go in for about 3 minutes or so. It depends on the spa, that you go in for roughly 3 minutes. They chill the air temperature down to about negative 264 degrees, nitrogen chilled air, and it puts your body into sort of survival mode. So you start burning off a lot of calories, they say, and overall it's supposed to help with reducing inflammation. And there have been some studies to suggest that's the case.
Right. Now, we do know there are certain medical benefits. For instance, in medical settings in hospitals, you can control bleeding before irreversible damage occurs to the brain, organs. If it's a gunshot victim, in cardiac issues, I mean, we do cool the temperatures down to help the body, and we essentially can alter blood flow and make changes. And there's certainly been a lot of studies, and we've seen that in the clinical setting, and there's advantages of that. You just said it yourself, like what's the studies that are being done, and I can tell you're not exactly pushing the concept of the salons, but tell me a little bit of why it's getting, from your perspective, so much attention. You know, Lindsay Lohan, Shaquille O'Neal, Michael Phelps, all these different people who seem to have gravitated toward it.
Well, I think in general it's getting a lot of buzz because, you know, it's really something new, it's very sexy. And I think that, you know, there's a lot of debate about whether icing does work, and there's a lot of believers who say it is effective. And if you're into icing, you know, you have to sit in a tub of freezing water for, you know, 30 minutes when you can go into a cryotherapy salon and just go for 3 minutes. It's not a very comfortable 3 minutes, but certainly better than sitting in a tub of ice water for 30.
And you wrote an article in a magazine called Outside Magazine where you talk about this, and in your dealings with it and trying to look at the different aspects of it. Did you come away amused, impressed, disappointed? What would you say your take on it was?
Yeah, I tried it. I was kind of freaked out a little bit about trying it, but I thought, well, it could be fun, and 3 minutes isn't a terrible period of time to do it. You can pretty much do anything for 3 minutes, and it was entertaining because there were several people there lined up to use the chamber, and they really were, you know, full believers in the fact that it was working. One person told me that they'd lost a lot of weight doing it on a real regular basis. Another person said that it was helping his back pain and arthritis. So it was an interesting peek inside this culture of ice bathers or cryotherapy fanatics.
What do you see the future of it as we're talking about? Do you think it's something that will continue? Do you see any intrinsic value to it where maybe it will be used in different ways going forward?
Well, Well, one of the sources that I talked to when I was reporting the article said that the trend is just skyrocketing. There's currently one spa in New York City, and he told me actually by the end of 2016 he thought there would likely be 7. That might be an overestimate, but he clearly was making the point that these things are becoming increasingly popular. So, I think they'll probably become more widely available to people. It's not that expensive to do one session at a time. It's about $90, which is probably comparable to going to get a massage. But it's, people might start having them in their homes the way they had tanning beds. A lot of people had tanning beds in their homes years ago. I think some athletes and celebrities already have them in their homes, so maybe that's something that trend will take off in the future.
Now, you're obviously a writer. You look at different areas to do articles. What excited you about this? Was it just an assignment you got, or was it something you said, boy, this seems to be a growing trend, I want to look at it?
Well, the thing that got me excited about this was I was doing some research, and I kept coming across these cases of people who had reportedly frozen and to near death and were able to be revived because of medical treatment and basically more awareness about what's going on with the human physiology in the cold. And it all comes back to that. I mean, these cryotherapy chambers, the idea is you chill your body down to such a cold temperature that, your metabolism gets going, your body's in that fight or flight type of mode, and you can, it has these sort of benefits when the blood goes rushing back to your extremities. You get a real rush of blood to your extremities, and that has benefits in, endorphins and endurance and things. But, it all sort of came back, this and some of the other things I wrote about all sort of came back to these cases of these people who were found frozen and were able to be revived. And there's a lot of medical science that's coming from that discovery, which has to do with the cold and its effect on human metabolism.
You are listening to Primary Care today on ReachMD. I'm your host, Dr. Brian McDonough, and I'm speaking with Renee Ebersole. We're talking about the new science of freezing could save your life, an article that she wrote for Outside Magazine. I want to ask you about that a little bit, the things we're learning and what you learned about what we're learning, because that is an area in medicine where I know I'm intrigued by the idea that, when the temperatures go way down, metabolism goes way down, and we're able to treat patients sometimes far more effectively than we used to. Basically, if you're dealing with situations, especially when you're talking about reducing blood flow, metabolism, those things. What have you learned from the research you did as to what the scientists are saying right now?
Yeah, it's a very basic principle. It makes a lot of sense. Basically, as your body cools down, if you become very cold very quickly, it helps your body. The cold actually becomes a protectant. It makes it possible for you to enter basically a state of that's similar to suspended animation, in which your metabolism slows to such a pace that your brain and organs can survive on just a tiny bit of oxygen. For every 1 degree Celsius drop in temperature, your metabolism slows by 5 to 7%. So there's so much that already we use that awareness to chill people down when they're experience cardiac arrest, on that basic level. But doctors are starting to take that much further now. They're looking at using chilling the blood to do surgery for people who are, basically on death's door because they've had gunshot wounds or, they've been injured in an accident. There's a lot more that can be done with that idea of chilling down the body to lower the metabolism and getting medical benefit.
And as we're really, like you said, no pun intended, at the tip of the iceberg here, looking at this, there's an opportunity for growth and development in that area. What have you seen as the dangers from your perspective? I mean, what concerns you, especially with this trend and or with the changes you're seeing from what you've read about as well?
Well, the trend of the cryotherapy spas, I think they need to be regulated. There is no FDA regulation for those at this time, and I think there needs to be some regulation and oversight to make sure that these things are safe, and that someone isn't actually going to experience any sort of long-term effects from, there isn't a lot of screening to make sure that someone doesn't have sensitivity to cold. There's no doctor involved in receiving any treatment, and it really is a pretty extreme experience. So that's one thing. I think there needs to be regulation for the cryotherapy spas. I also think that by learning this information about people who are maybe in an outdoor situation where they do appear dead, I think that with more training where people can actually recognize the fact that someone isn't, they may appear dead, but they might not necessarily be dead, that they might actually have an opportunity to be rescued and go on to live a completely normal life. If there needs to be more awareness and more protocols for those rescue operations, and I hope that, through articles like what I wrote and through conversations like this one, it'll help get the word out that people should be really, you're not really dead before you're warm and dead. It's actually true, I think. It's something that should actually be practiced pretty heavily.
Well, I think your warning is a very important one, especially, we've learned enough just by people who do the indoor tanning, the issues that are associated with it. Just because something is in a mall and it's in a store and it appears safe, it doesn't necessarily mean the protection is there or it is regulated. And I think a lot of people don't understand that many of these types of settings, there is no regulation. It's more or less an opportunity for someone to try something out, but at little scientific background. And as far as research and what's been done, any studies, anything you've looked at that you feel really stands out as something that physicians or other healthcare providers should be really looking at that you came across, an article, a book, something that you thought really was interesting in your research?
Well, I think the new studies that are happening, there's actually a live human trial happening in Pittsburgh right now where doctors are taking gunshot victims and people knife wound victims, and as they arrive at the hospital, if they seem basically, like there's no possible opportunity for rescuing them, they're actually doing this very invasive method of removing the blood from the body and replacing it with this very cold saline solution to essentially, potentially, put the person into a state of suspended animation so that they can gain enough time to do the life-saving surgery that they need to do, literally stopping the clock, so that those patients can be treated before they bleed out on the operating table. So I think that has tremendous possibility, and it'll be interesting to see what happens as those studies continue to develop and are tested at other universities and hospitals.
To your point, it makes a lot of sense. It would seem to be physiologically, it would make sense because you could slow things down, which is one of the big goals you want to achieve with people who have been victims, and especially if there's massive blood loss. We only have about a minute left with Renee Ebersole. I want to ask you, is there something you wanted to bring up that you thought was important we should have addressed? There's
a lot of potential for life-saving medicine that can come from the discoveries about people and physiology and the limits of withstanding the cold and the line between life and death, depending on where it actually lies. So I think we're learning a lot more about that, and I think we have a lot more to learn. I admire the researchers who are really trying to take things to another level and thinking out of the box and trying to save people who up until now might have been considered unsavable. I think this is a really exciting time for science and medicine, and a lot of it might have to do with cold.
Well, Renee Ebersole, I want to thank you for joining us on Primary Care today. Essentially, we've gone from the stories of Walt Disney and Ted Williams to something that really does have an impact and a real potential impact in our own health and our own health care system. I'm Dr. Brian McDonough. If you missed any of this discussion, please visit reachmd.com/primary care today. You can download the podcast and learn more on the series. Thank you so much for listening.